Morning, Doctor.
Oh, hi, good morning.
Good morning.
My name is Dr. Chris Sawh.
And my name's Dr. Ginevra Pillinger.
I am a consultant cardiologist.
And I'm one of the junior doctors on cardiology.
Today we are both on call and I would like to show you the busy lifestyle in cardiology. And I would take you through a patient journey of someone who've had a heart attack.
Hello, Dr. Pillinger. Okay, what's the name of the patient? And can you give me his date of birth, please? Okay, any past medical history at all? Okay, and what does his ECG look like? What was the time of his cardiac arrest? Okay, and can you tell me about what time you might be arriving? Could you give Dr. Sawh a bleep, please? We've got a gentleman coming in via helicopter. Dr. Sawh is now on his way so that we can go and receive the patient from the helicopter. Hi, Dr. Sawh. We've got a 75-year-old gentleman coming in on the helicopter. He's had an out-of-hospital cardiac arrest after sustaining a heart attack. They had to shock him twice before regaining consciousness, and the paramedics report that he's in cardiogenic shock. He's on his way now.
What's his estimated time of arrival?
15 minutes.
And have you informed the team?
Yeah, I've informed the team and they're preparing the lab now.
Oh, great.
Dr. Sawh and myself are now heading down to the emergency department to receive the patient.
How old is he?
73.
We suspect you might be having a heart attack and the plan is to fix it. Have you ever had any heart trouble before? And have you had any chest pain after that? No. You have diabetes or high blood pressure?
Yeah.
High blood pressure. Any other medical illness?
Obviously, this is a very critical time for the patient, but it's also a really difficult time for the family. So now I'm just going to go and speak to the wife and update her on what's been happening. Hi, Mrs. Slaughter. My name's Dr. Pillinger. I'm one of the cardiology doctors. I'm sorry to have to tell you that your husband has suffered from a heart attack. It's a very critical time, but he was rushed here in good time with the emergency services, and he's gone straight to our lab where we treat people acutely for a heart attack.
I have here a 73-year-old patient who presented with an acute myocardial infarction. He's got what we call a STEMI, an ST elevation MI, and this is considered an emergency. We're planning to take him to the cath lab and fix his coronaries immediately. The plan is to get him in the cath lab as quick as possible and open a blocked coronary. To fix the heart, we will be going from the wrist. So I will go with a tube from the wrist here all the way to your heart. I will inject contrast and take X-ray pictures. Are there any questions or anything that you want to ask? Are you happy for us to go ahead with the procedure? That's fantastic. So we will go ahead.
Dr. Sawh is now going to the cath lab to prepare as our patient is introduced to our team. As you can see now, the team are behind me getting this patient ready for his coronary angiogram. This allows us to visualize the vessels in the heart so we can find out where the blockage is and treat it as soon as possible.
We have the patient now in the cath lab. We're about to do his procedure. We will do a quick checklist, but before we do that, I'll introduce the cath lab team. I'm Chris Sawh, I'm the consultant cardiologist. I have here one of the scrub nurses with me. This is Lorraine. I've got the radiographer, Rachel. I have here Louise, and we have ECG physiologist, Faye, basically having a look at the pressure and ECGs. And I'll first start by gaining access. We're going to use his right wrist. We could use your left wrist or your groin as well. This is the catheter. These are the ones that we would use to take the pictures and do the procedure with.
The team have now imaged the arteries of the heart and they found the blockage that needs to treat. They're now preparing to stent. The patient's blood pressure is dropping rapidly and he is now in cardiogenic shock. The team behind me need to act very quickly to stabilise the patient in order to continue the procedure.
Great. And let's give him metaraminal 0.5 milligram IV. Let's get a balloon pump ready. We might have to use it here, but just warm it up.
BF arrest!
can you all start CPR quickly? Let's get the pads. Let's attach it to him.
1, 2, 3, 7, 8, 9. The patient has now gone into a cardiac arrest, and the team is trying desperately to resuscitate him.
Let's do a rhythm check.
No pulse.
Okay, can you shock, please? Shock.
Stand clear.
Start that
Oxygen away.
CPR.
1, 2, 3, 4, 5, 6, 7.
Shock, please.
Charging, stand clear. Shocking.
Thanks to the quick response of Dr. Sawh's team, they have managed to successfully resuscitate the patient. They are now able to continue trying to fix his coronary artery. Despite the team's best efforts, the patient remains unstable. The team will now have to use an artificial pump to keep the patient alive while we continue to try to fix his heart.
This screw flex instead. 2-5 screw flex.
The patient has now been stabilised with the balloon pump.
So we've just finished the procedure. He's currently pain-free, and hopefully this is all that he would need. From here, he'll be transferred back to our coronary care unit, where he would be kept for 24 hours, and he would spend between 48 to 72 hours in hospital, and he should be discharged after that if everything goes well.
We're now going to follow Dr. Sawh into recovery, where he's going to explain to the patient what's happened in the procedure, his ongoing monitoring, and his medical management once he leaves hospital.
So this patient is now on the coronary care unit. This is the coronary care unit room. He's being monitored. The nurse is currently doing an ECG for him. He's now pain-free, he's stable. His blood pressure and his heart rate, all of it looks great. Now that his vessel is open, everything should go great from here. We do monitor patient for 24 hours in coronary care unit after having a STEMI or an acute heart attack. In this gentleman's case, I'm planning to send him home after 72 hours. During this time, he's going to be on several medications, which are there to thin his blood and keep the stent open, but also medications to prevent a further heart attack. I'm now about to see Mr. Slaughter. He's our patient who came in with an acute myocardial infarction yesterday. Today is now 24 hours since we've done PCI to him. It's been 24 hours now since you've been in hospital. I have had a look at all your tests that was done. Do you think you know one of the main reasons why you had a heart attack?
I would say smoking was a...
So you're a smoker, and I think looking back at your medical history of all the things that you have, I think in your specific case, smoking was the main reason why you perhaps had the heart attack. Yeah. So my advice to you is stop smoking.
It's now been 7 months since the patient had his heart attack, and he's now come back to see Dr. Sawh for a routine follow-up appointment.
Mr. Slaughter,
Yes.
Dr. Sawh is ready for you. If you'd like to follow down.
Thank you.
Mr. Slaughter, very good to see you. Take a seat. How have you been?
I've been very well, thank you very much.
As you know, we fixed your heart by putting in a stent to open your vessel. Have you had any chest pain since?
No.
Do you still smoke?
No, never.
Oh great, so you stopped smoking?
I'll stop smoking all the time.
I'm very pleased to hear. Great, can I examine you?
Yes, you can.
Great, come on. I'll take your blood pressure. So it's been 7 months now since you've had your heart attack.
Mm-hmm.
From examining you today and looking at all the results, I must tell you that I'm very pleased and satisfied with everything, with how you've progressed. Okay, Mrs. Slaughter, it was certainly a pleasure seeing you.
Thank you very much.
Great, and I hope everything goes well from here.
Okay, thank you
All
very
right,
much.
take good
Thank you
care.
very much. Thank you.
How are you doing?
I'm going to leave now, Linda.
See you tomorrow.
See you tomorrow.